Hello and welcome. I'm Vishal Dahiya and you're watching our special show India Fights Back, where we take a stock of the battle against COVID-19 pandemic. Today we're going to talk about one of the vaccines which India has been utilizing against this pandemic, and that is Covishield. Now, in view of the emerging scientific evidence, the interval between doses of COVID-19 vaccine Covishield has been revisited by National Technical Advisory Group on Immunization and subsequently by the National Expert Group on Vaccine Administration in its 20th meeting. Now, during this particular meeting, the recommendation has been revised to provide second dose of Covishield at 4 to 8 weeks interval after the first dose instead of the earlier prescribed and practiced interval of 4 to 6 weeks. Now, this decision of revised time interval between two doses is applicable only and only to Covishield and not to Covaxin. Now, Covishield is, and let us remind you, Serum Institute of India's version of AZD1222, the vaccine being developed by AstraZeneca in collaboration with the University of Oxford. So today we are going to understand the whys and hows of this decision, rationale behind increasing that interval between two doses of Covishield, and also how will it help us in this battle against COVID-19 in the longer run, and looking at the overall vaccination drive as well. And for more on this, we're joined by two distinguished experts. Let me first introduce them to you, beginning with Dr. Samiran Panda, who is joining us. He's member of NEGVAC and head of the ECD division in ICMR New Delhi. We are also joined by Professor Y.K. Gupta, National Scientific Coordinator of Pharmacovigilance Program of India, and has been closely involved with this entire battle against COVID-19 as well. Welcome both of you, gentlemen. Let me begin with you, Dr. Samiran Panda. Let's start by understanding this decision and obviously the whys and hows here. Why this interval has been increased further by 2 weeks between two doses of Covishield.
Well, the genesis of this revision of decision is or rests or lies with a publication. Any dosing interval is decided based upon the trials that precedes a programmatic decision. So in terms of Covishield, the Lancet publication that came out, this particular publication looked into different dosing interval between the first and the second dose. One was 4 to 6 weeks interval. The other one was what happens if the second dose is taken or administered after 8 weeks of the administration of the first dose. And then what happens if one gives the second dose at a gap of 12 weeks following the intramuscular injection administration of the first dose of the vaccine. And the efficacy of the vaccines, the absolute to be gradually increasing when the dosing interval was increased. So that created a whole lot of discussion in the people, in amongst professionals, as well as in social settings, discussions, debates, discourses, that is it true if we increase the interval between the two doses, we get better efficacy. Now, this change of or revision of the decision, we need to read it very carefully. Previously, it was 4 to 6 weeks of gap between the first dose and the administration of the second dose. And the revised version says the second dose can be administered between 4 to 8 weeks. So the earliest administration can still happen at 4 weeks. Now, I will take a little more time to explain what does this mean. So this means that if I have, for whatever reason, not been able to take my second dose following the administration of the first dose within 4 to 6 weeks of the first dose, then I should not panic. I can still go ahead and get my vaccine so long I'm taking it within the 8 weeks of the administration of the first dose. However, if somebody thinks that, oh, okay, I have taken my first dose, let me delay my second dose because my efficacy will be more, that's a wrong interpretation. Because these efficacies are at the population level, number one. Number two, if one increases the interval between the two doses, there is a chance of getting infected in between, which is called breakthrough infection. And that will not be a very smart move. So this particular revised decision is from public health perspective. It is to allay the anxiety and also to address the confusion that was going around after the Lancet publication came out. However, at different intervals when the efficacy was examined, the uncertainty bound around an efficacy figure was overlapping with each other, which essentially means that there is not much of a difference in terms of the efficacy at the population level if the dosing intervals are changed from 4 to 6 weeks to 8 weeks to 12 weeks.
Okay. Fair enough. There, the explanation coming in from Dr. Panda, trying to understand the rationale behind the increase in interval of the second dose after the first dose of Covishield has been taken. Now, Professor Y.K. Gupta, we would like to hear your views on this rationale, as Dr. Panda also explained, and also the efficacy aspect. How will it impact, or does it impact at all?
I think Dr. Panda has given so beautiful answer. I have to just repeat what he said. And the issue is, when you give first injection of a vaccine, the antibody or immunogenicity start coming up. And then when you give second dose, which is a booster dose, your immunogenicity goes up. And what has been studied, that at a frequent interval, 4 weeks, 6 weeks, 8 weeks, 10 weeks, 12 weeks, and this research, which he has also mentioned, showed that in a population not in India, but in abroad, that after 4 weeks, the immunogenicity, and after 6 weeks and after 8 weeks, the immunogenicity was better, was higher. That means at a population level, if you convert this, that their immunogenicity is not decreasing, rather it is increasing. What does it mean? What does it mean to me, you, and the population? It means that there is a wider window now that you can go for second dose between 4 weeks and 8 weeks. Not necessarily that you panic. This has happened in my family also. That after 4 weeks, 2 days happened. Oh, rush. This is a 4 weeks. Ho gaya, 28 din ho gaya. No need. You have a wider window. You can go up to 8 weeks comfortably. Okay. And very rightly said that if somebody says that after 4 weeks, humne laga liya, then it is risky and I have committed mistake. No, you have not committed mistake. You are very well protected. And in some cases, when there is a severe infection and breakthrough disease, it can also protect that, because you have to have a degree of immunogenicity. Here, the important thing for public perception is that those who have got at 4 weeks are also protected by the same method, by the same claim which it was earlier. So now, the revised version is, instead of 4 to 6 weeks, we have increased the window from 4 to 8 weeks. So it is not that after 8 weeks, the longer you go, or you go after 3 months, you think that it will be better. No, it will be disastrous. If you go after 12 weeks, no, it will not be correct. Between 8 weeks, it is the best.
Okay. That clearly, explains this entire concept, and then we'll try and look at the other aspects as well. But I'll first like to, further clarify the entire issue for our viewers. And since I mentioned it in the beginning itself, that this recommendation is only for Covishield vaccine, which is one of the 2 vaccines being used in India against COVID-19, the other being Covaxin. Now here, we would like to understand, Dr. Panda, and I wanted to come from you 2 experts here to explain to our viewers the difference between why it has been done for Covishield and what exactly is the interval if you're looking at in the other vaccine case.
All right, this is a very important question. First of all, if you wish to understand the difference between the two vaccines, Covaxin is a vaccine which has been developed through a platform which is called whole virion killed vaccine. And Covishield is part of the virus, which is SARS-CoV-2 that causes COVID-19, that is actually inserted into another vector, adenovirus, which then carries that part of the virus, and that's injected. So the platforms are different. However, both the vaccines are administered through intramuscular injection. And both the vaccines went through the phase of preclinical studies, followed by clinical trials, which is phase 1, phase 2, and phase 3. And phase 1 indicated that both the vaccines are safe. Phase 2 indicated that both the vaccines had capability to produce immunogenicity. And phase 3 is about efficacy in real life setting. Now, how did this discussion happen with Covishield but did not happen with Covaxin? Now, following the trial, as very rightly indicated by Professor Y.K. Gupta, these big phase 3 trials happened in other countries. What India did for Covishield is the bridging study, which is much smaller involvement, 1,600 participants. That's called bridging study. However, in the large trials, these got published, the phase 3 trials, and then subgroup analysis was undertaken, meaning accidentally or unintentionally, some of the people, maybe due to the lack of supply, received vaccine at delayed intervals. And in those subgroups, an analysis was done to figure out how did the immunogenicity change amongst those subgroups which received the second dose of the vaccine later than the actual intended interval of 4 weeks. So two things need to be understood in this respect. The subgroup analysis always involves much smaller number of participants, number one. And number two, these are not part of the randomized control trials. It was not designed that one group will be receiving 2 doses at a gap of 4 weeks and another group will receive it at a gap of 12 weeks and then there will be head-to-head comparison. No, it was not that. So it is basically subgroup analysis which involved smaller number of participants, and that's why we say, although there was an indication of increased immunogenicity and a little bit of increased efficacy, but the uncertainty bound around the efficacy, they overlapped. So we cannot really claim much advantage by increasing the dosing, and I would say that's why it is not very prudent to change drastically a public health decision based on subgroup analysis. On the other hand, for the Covaxin trial, no such subgroup analysis was attempted, so it still adheres to the dosing interval of 4 weeks between the first dose and the second dose, which was observed. And we all now know about the interim analysis finding, which indicated 81% efficacy, but that also at the population level. At the individual level, we are safe if we take any of these vaccines. We are capable of producing immunogenicity if we take these vaccines as indicated. And thirdly, we should not forget that despite taking the vaccines, after the second dose, it takes 14 days minimum, 2 to 3 weeks, so that the immunity kicks in. So we should not lower our guards between the 2 doses and 2 to 3 weeks after the second dose. And the vaccination should reach a very good coverage at the population level. And all of us need to adhere to our COVID appropriate behavior while we are getting ourselves vaccinated and our near and dear ones in the community.
Okay, indeed, that aptly sums up this entire issue as well. Professor Gupta, would you like to add more to this, this comparative analysis which Dr. Panda was pointing out between these two vaccines, Covishield and Covaxin, and why there was, need for this, bringing in this change in the interval period of 2 doses in just in Covishield and not in Covaxin?
I would say everything here is evidence-based, and as we progress, the evidence progresses. We have seen that our lazy group of subjects who could not go at 4 weeks, like me, they went for vaccination at 6 weeks to 8 weeks. And it indicates that how meticulous our vaccination program was or is, that many people got their antibody immunogenicity tested. And what we found in an analysis of this subgroup, that the immunogenicity level increased, and you can say remained at a high level, and then the analysis showed that there is no problem if you take this between 6 to 8 weeks. Now, this does not mean that this will hold true for every vaccine. Now we have a Covaxin, tomorrow we will have the vaccine from Zydus, to next day we will have vaccine from Sputnik, and then we will have vaccine from J&J, and at least 4 or 5 more vaccines coming up. No uniform rule apply for all. Everything will have to be determined based on its immunogenicity and the evidence you generate. So no generalization, evidence-based, and that is what, and finally I would say that it means 70%, 80%, 85%, 90%, this is a population based. One should not get carried away with this figure. For me, a vaccine is a vaccine. It is preventing, and it does not mean that it gives me complete, even if you have a helmet, you can meet in some accident.
Definitely.
So your important thing is have absolute faith on the what is called as a COVID-19 behavior, or hand washing, mask wearing, and social distancing. I think this, and of course eating good healthy food, that remains the gold standard. Vaccine is here to protect us. Do not, my message through you is to the public, do not get panic at all. It is a comforting news, and go and get your vaccine, your vaccination done.
Okay.
If not already done.
Indeed, and that is coming in from somebody who's also got himself vaccinated. Professor Gupta, they are quite an interesting and important point made by you, that vaccine does protect us, but we cannot lower our guard vis-a-vis COVID-19, and the COVID-appropriate behavior is the key to fight this battle. Now, let's look at one more aspect, and I'd like to start with you, Dr. Panda. Does this change in the interval of 2 doses also have some effect on the logistic aspect of the entire vaccination drive? Because let's not forget that we have 2 vaccines, Covishield being one of them. And if you're looking at the timeline and, in terms of how many do we want to vaccinate by which date, it does have a lot of, important aspect here of how many gets, vaccinated in the with the first dose, and how many get the second dose later on as well.
All right. So let's first of all acknowledge that the way vaccination program is being rolled out currently clearly indicates that there are vaccine or vaccination session sites, the booths, if you like it, and those booths are specific in terms of either offering Covishield or offering Covaxin. So the booths are specific, and that's the logistic arrangement that we are following. Now, let's now focus on the booths which will be offering Covishield. While a person, after receiving his or her call or the message on the mobile, goes and says, here I am for receiving my first dose, he or she will be given this information that your second dosing schedule could be set up either at the gap of 4 weeks or anytime between the 4 to 8 weeks, and do you wish to choose? And that date gets informed to the person, through the CoWIN software. But I would also try indicate 2 other important issues. People should never see these 2 vaccines as interchangeable with each other. So if I have received first dose of Covaxin, I should stick to the second dose of Covaxin at a gap of 4 weeks, or that's the stipulated time gap. And if I have received the first dose of Covishield and my second dosing date has been scheduled while I am receiving my first dose at the vaccination sites. I would stick to that, and I have that window of opportunity. So even if I miss that dose, because it so happens sometimes we fail to adhere to the scheduled date, so long I'm within the period of 4 to 8 weeks, I should be fine. The third point that I want to highlight, that vaccines prevent us. Even if we get the infection, vaccine prevents us, both the vaccines prevent us from getting into the severe form of the disease or advanced clinical stage of the disease, or even complications that require hospital admission or in unfortunate events might lead to death. So what vaccine does is preventing symptomatic disease, occurrence of it, or complications or deaths. So we should not forget that even following vaccination, it is possible for me or anyone to acquire infection and to transmit it. So it's so very important to realize that while we are going ahead and taking part in the vaccination program.
Okay. But does this, new norms in terms of interval also help us in covering more people in less amount of time, in terms of at least providing them with the first dosage?
Honestly speaking, if you take a set of 6 COVID-19 vaccines, 4 to 5 of them are Covishield and 1 is Covaxin. That's the supply ratio that we have now in India. That is dependent on the supply that the companies are able to offer to the government. But India is not a vaccine deficient country at all. So the whole decision is not based on unavailability or non-availability of enough supply. So we try to give 1 dose to everybody first. So the situation here is very different from the situation in European countries. So I will underline here that India is really doing great in terms of not only availability of the vaccine, it's not just 1, we have 2 within 10 to 11 months of knowing the genome sequence of the virus. And secondly, India never took the vaccine nationalism route. So while we were thinking about ourselves, we are also giving vaccines to other countries. So we believe that the entire world is one family. So we never thought of only ourselves. So these are the 2 things I want to highlight. And the decision of increasing the interval is to allay the confusion that got generated in the people following the publication that came out in Lancet. But it has got nothing to do with the assumption that India is running short of supply of vaccines or anything like that. Covishield.
Okay, so it's entirely based on scientific evidence out there, as Dr. Panda is pointing out. Concluding comments from you, Professor Y.K. Gupta, in terms of the overall logistic mechanism which is there, and the impact it might have, this decision of increasing the interval might have on the entire logistical process of the vaccine delivery mechanism. Professor Gupta, you will have to unmute yourself, sir.
I would just send a message to you as follows. People should not get worried about that. Is this vaccine good? Is this vaccine good? Often this question is asked to us. हम कौन सी vaccine लगवाएं? ये लगवाएं, वो लगवाएं. Any vaccine is good. Both vaccines are comfortable and the safety has been tested. So one should not worry about which vaccine. 2, this schedule of Covaxin is 4 weeks. Schedule of Covishield is 4 to 8 weeks. 3, those who have missed the 4 weeks in Covishield can go up to 8 weeks. Those who are getting Covaxin should preferably, as much as possible, should adhere to the 4 weeks interval. Data does not, we do not have data of Covaxin for 8 weeks or 12 weeks. Therefore, we cannot say. And therefore, 4 weeks should be adhered. Number 3, logistics. Certainly, this might have created confusion in minds of public, but to allay that, this effort through you that no worry. If you have missed 4 weeks, here is a time up to 8 weeks, comfortably you can go. And also to educate, as was Dr. Samiran said, don't try to mix. One, A means A, B means B. This has increased some logistic issues to the government, to those who are giving vaccine. That means they should remember, they should educate, and they should tell that what is the science, what is the logic behind this.
Okay.
And otherwise, there is absolutely no logical difficulty, no logistic difficulty. Only issue is we have to educate the people, not to worry about, and we are absolutely safe with both the vaccines.
Okay.
We are safe. I will not say absolute. We are safe.
Okay, there it is. Thank you so much, Professor Gupta and Dr. Samiran Panda, both of you, for sharing your views and insights on this very important aspect, the recent decision which has been taken based on scientific evidence that the interval between 2 doses of Covishield can be 4 to 8 weeks instead of the earlier prescribed 4 to 6 weeks. And as our panelists were pointing out, this entire vaccination drive is for our benefit, all of us, specifically those who've been prescribed to take this vaccine. And the recent decision from the government is allowing everyone above 45 years of age to go in for vaccination drive, get yourself inoculated, and follow the prescribed guidelines and procedures as well. But while we are at it, let us also remind you that vaccine can protect us, but it is the COVID-appropriate behavior which will go a long way in ensuring our safety, and it is a simple 3-step process. One is wear your mask at all times while you're out in public domain. Also ensure that you wash your hands regularly. Hand hygiene is really important, and so is following physical distancing of at least 6 feet from others while being in public. These 3 simple steps will go a long way in protecting you and your near and dear ones. We'll come back again. Till then, keep watching Sunset Television. Thank you.